Hello, this is Dr. Paul Jellinger. I'm medical editor of Clinical Endocrinology News, and I'm here with Dr. Phil Levy from Phoenix, Arizona. One of the real hot topics in diabetes today is the relationship of cancer to both diabetes itself and perhaps the treatment of diabetes. There was an illuminating session the other morning delivered by Dr. Harold Leibovitz on just that topic, the relationship of diabetes and cancer. So Dr. Levy is here to tell us about that session and what his own thoughts are in relation to this very interesting and controversial topic. Dr. Levy, what can you tell us about the presentation the other day?
It's quite interesting that people who are obese and people who have diabetes have an increased incidence of certain cancers, specifically cancers like bladder, colon, rectum, pancreas, liver, breast. And these are increased, and they're dramatically increased compared to the non-obese and non-diabetic population. And the relationship of insulin with these has come up since insulin is a growth factor, and there were some reports several years ago that perhaps insulin was one of the etiologic factors. It doesn't appear, at least as far as the data that's there now, it doesn't appear that that insulin is really a factor, but certainly diabetes and obesity are factors. And there have been several studies, for example, where obese people have had gastric bypass surgery, and they've looked at the incidence of diabetes in these people before surgery and after surgery in terms of their peers. And the women have a decreased incidence of all these cancers compared to what they would if they didn't have the surgery. Men did not seem to show any difference, interestingly enough, and we don't know the reasons for that.
So when you say insulin doesn't appear to be a factor, you're referring to exogenous insulin, the administration of insulin.
Yeah, yes, that's correct.
We certainly don't know whether the hyperinsulinemia that many diabetics have internally might be the basis of some of these increased incidence. We don't know that.
Well, that's correct, and
Right.
It might be a factor, and maybe that's why things like gastric bypass surgery, where those factors disappear,
Right.
might have something to do with the decreased incidence of cancer. There was a paper originally that suggested that exogenous insulin might play a role, but that was one isolated study, and nobody's been able to duplicate that data.
Is it fair to say that there was a great deal of interest 2 or 3 years ago, but that it has really died down, and that we really don't believe that administering insulin of any type increases the risk of cancer in our patients? Can we say that issue is, I won't say dead, but almost dead at this point?
Yeah, I think that's a fair statement.
Okay, great. When we see our patients with type 2 diabetes, are there any recommendations to increase our surveillance of these patients for cancer? Should we be looking extra hard, so to speak, more frequent checks of the things we keep an eye on in general? Has that not become a recommendation yet?
Well, I don't think that's become a recommendation. Well, you should obviously have your eyes open for cancer, but some cancers are not easy to screen for. For instance, pancreatic cancer. Right. What would you do? I had a patient, for example, who for another malignancy had an MRI done every 6 months, and then all of a sudden he shows up with a pancreatic cancer. By the time they found it, it was too late to do something about it. So some of the cancers are easier. And I think, for example, with bladder cancer, I think you should at least do a urinalysis and look for blood in the urine, because most of the time bladder cancers present with hematuria. And certainly if they're cancers that are easy to detect, we always ought to examine our patients and not forget the examining fingers and the stethoscope, et cetera.
And make sure our diabetic patients get colonoscopies at regular intervals, whatever's recommended.
Preventive.
And mammograms. Well, thanks very much. Sounds like a very provocative session. I've heard from many attendees that was a very interesting session. I'm glad you were able to share the findings with us.
Well, thank you. Thank you.
Bye-bye.